Hi, I'm Karen Harrington. I'm the director of the Student Continuity Practice at the University of Connecticut School of Medicine. Today, I'm going to talk to you about using negotiation skills to maximize your learning. So, why is it important to learn how to negotiate? Our students are active learners, and their experiences depend on their ability to navigate the student-preceptor relationship. All through your education, you will be working with a variety of preceptors, and learning how to negotiate is an important skill. Many of our preceptors have been teaching for a long time, and they are very interested in being teachers. However, occasionally some will need some guidance in knowing the students' learning objectives. Therefore, it will be important for you to help them through this process. Negotiation is a lifelong skill, and for both personal and professional roles, it will be important for you to develop these skills through your medical education. What follows are some common issues that some of our students encounter in their beginning medical education. Scenario 1. It is January of the first year of medical school, and you still have not had an opportunity to interview patients on your own, and your preceptor has not observed you directly as you interview. Please watch the following scenario.
Whew. All right. Hi. Hey, Avery.
Hi.
Quite a busy session here. I think we're finally done. Doesn't look like there's anyone else here.
Hectic little afternoon, I know.
Yeah. How you doing?
I'm good. Does it sound like we're pretty much wrapped up for the day then?
Yeah. I don't see anyone else. I think we're done. We're on our own now.
Great.
Good.
Actually, there's something I've been hoping to chat with you about if this is a good time for you.
Sure. What's on your mind?
Well, first off, I was hoping to kind of get a feeling for how you think I've been doing at SCP.
You're doing great. I think it's been a pleasure having you here. The staff and patients seem to like you a lot.
Awesome. So you feel like I'm kind of blending into the practice pretty well?
Yeah. Do you feel like you're getting the experience of the practice and seeing what it's all about?
Yeah, I definitely feel like, it's been a really welcoming and a warm practice, but one thing that I was hoping to do is now that it's January and I've been here for a few months, a lot of my other classmates have started to see patients on their own at SCP, and I haven't really gotten the chance to do too much of that, and so I was wondering if it would be possible to maybe see 1 or 2 patients on my own each week, if that would work out for you as well.
I think that that's a good idea, actually. I think you've been here long enough, you have a feel for the place, and we have a feel for you. I think actually that would be helpful, and I could see, with especially how busy we are, that you could be in seeing someone and I could be in seeing someone else, and we could meet up together. And so I'm comfortable with that at this point.
Awesome. That would be great.
Good.
Also, I know it'll be hard sometimes if you have patients to see on your own, but it would be really helpful if maybe you could try and peek in and watch me for maybe 1 or 2 patients so I could get some feedback on how I'm doing.
Yeah, that's also a good idea. Do you think you have enough knowledge about history and physical at this point to be doing that?
Yeah, we've learned all of the history up to this point. We haven't really started the physical yet, which we'll be doing this upcoming semester, but it'd be great if you could show me some of that, and if I could just start practicing the history, I think I'll get better at it as I go.
Okay, I think that's a good idea as well. With how busy it is and how busy I am, it might be that I'm coming in and just seeing part of your visit or part of the exam. But even that would be helpful. I have to fill out evaluations for you a couple of times a year, and I think it really would be helpful for me to watch you do some of these things or parts of exams. So that's another good idea. I think we should start that, and we could start it right away the next time you're here next week.
Perfect.
In fact, maybe I'll look ahead at the schedule and identify a few patients that I think you could go in and see on. So I think that's going to help out a lot.
Awesome. That would be really great. Thank you so much.
Good, great.
Anything else?
No, I think we're done for the day. Thanks for coming.
All right. I'll see you next week.
Okay.
Scenario 2. You have completed the PCM coursework about behavioral counseling, and you want to practice these skills at your SCP site with actual patients. Despite reminders to your preceptor, you have not been able to find patients with whom you can practice.
Dr. Steinberg, do you have a minute to chat?
Sure. What's up?
So thank you so much. It's been awesome to be seeing some patients on my own this past month.
Great.
And I feel like I'm really getting a feel for the history. But I've been looking at my notes for my patient log, and we've been learning a lot about behavioral counseling, and we've practiced a lot in PCM, smoking cessation and exercise, but we really don't see patients here for any of that counseling, and I need to do it for my log, so I'm not quite sure how I can get this accomplished.
Yeah, I usually don't schedule people specifically for a visit just to come in for counseling. But as you know, I see so many patients with diabetes and hypertension and other chronic diseases, and that is important, and my time is so short, I don't get to do it as much as I'd like. So I think maybe what we can do is for people who are coming in with those chronic conditions or physicals who need some counseling, need some advice, I think we should have you do the counseling during those visits. Because I think just to expect a visit solely for weight loss counseling, that doesn't happen here that often. So why don't I'll make a point, and the next time we see someone who has one of those chronic diseases, I'm thinking hypertension, diabetes, lung and heart problems, that I have enough rooms here. Maybe toward the end we can reserve that time for some counseling. That would be good. Have you learned how to do that and done that?
Yeah, we've learned how to do that, and I just I've always practiced with the standardized patients, but they're only go so far, and they give you all the feedback. So I'd really like to practice it with real patients in a real setting.
Great. I think we can do that. We can start doing that. And again, I think the patients are all going to be here probably for existing problems, but we can definitely do that. And I can look for people that might need some extra counseling, and even if you haven't seen them, maybe send you in afterwards to talk with them for a few minutes.
That would be great if you could look out for those. I would really kind of like to practice that so I can add it to my log and get everything filled out.
Okay, that's good. I think that would work well, and I think that actually would enhance the practice a little bit.
Beautiful.
Good.
Scenario 3. It's the fall of your second year. You have not had much opportunity to do oral presentations with your preceptor, which is a clear requirement in the second year of medical school. You are also interested in learning more about clinical reasoning. Please look at the next scenario.
Okay, why don't you go ahead and get dressed? We'll be back in just a moment. Thanks. All right, so what do you think? What do you think he's got?
So actually we've been practicing presentations a little bit in PCM. I was wondering if I could possibly try doing a more formal presentation for her.
Well, I'll tell you what, we are pretty busy here and I'm a little bit behind, but how about we just have you present maybe the history part and the complaint, and then I can move things along a little bit, and that way you get some practice in for that. Would that be all right?
That would be great. Could I possibly maybe try the full presentation maybe later today or at a downtime?
Sure, I think we have some downtime at the end. I think maybe we could set aside a few minutes for like a more formal presentation so you can get some practice. It's a good idea.
Awesome, great.
Okay.
All right, so I'll give it a go.
Okay. Okay, why don't you go ahead and do the presentation of the history.
Okay, patient is a 14-year-old male who came into the office today presenting with...
All right, it sounds to me like this is pretty clearly a strep throat. Why don't we go ahead and maybe give him some antibiotics and then, talk to him about it a little bit.
Okay, how do you, though, know strep throat? We're just starting to learn micro, and, how do you decide that versus viral or something else?
Well, he has a lot of the classic features. He's running a temperature. You remember the white stuff that we saw in his throat, the exudate there, and he had the swollen glands here. So I think it's pretty likely in his age group that he has strep throat. You know what? How about later, when we're sitting down, we can talk a little bit more about some other things, and why we chose one thing or another.
That would be perfect. Thank you.
Okay, all right, you ready? It's a busy day this afternoon. Why don't we get going? You ready to come in with me?
Yeah, there's something I kind of wanted to talk to you about.
It's really a hectic day today. I'm pretty far behind. I don't know that we really have time for this. You ready to come on?
Yeah, that's fine.
You have had time to see the 3 scenarios, and we'll talk about some of the tips to think about when we address issues in scenario 1. Think about how you can set aside some time alone with your preceptor. What is the best way for you and your preceptor to work it within his schedule or her schedule for you to see patients alone? It's very important for you to have observation time. And how are you going to talk to your preceptor about making time for some observation? Another tip to think about is how can you work with people in the office to increase opportunities for time alone with patients? One of the things you could think about is looking at the scheduling of patients and making it clear to the office staff that it would be important for you to have this time alone with patients. Counseling. How do you go about getting some patients for counseling? Early in year 1, you are taught a great deal about counseling patients. Many sessions are devoted to the various kinds of behavioral counseling. You have the skills to practice these skills with patients, and it's important for you to be assertive and tell your preceptor that you have the knowledge and the skill to work with patients. And another tip is to remember that integrating counseling into a visit can be very easy if you think about the fact that every visit has the potential for counseling. It doesn't necessarily have to be that someone's coming in for smoking cessation. Many of the chronic diseases that you see at your SCP site would be good opportunities for you to practice some counseling skills, whether it be diet or exercise counseling. So when you think about oral presentations and clinical reasoning, it's important for you to think about what parts of the physical exam do you do for common complaints based on differential diagnosis. It's important that you as a student let your preceptor know of your increasing knowledge base and that you are eager to participate in clinical reasoning and the management of common problems. Performing oral presentations is a major part of PCM2 and is very important for you to have an opportunity on a weekly basis to do oral presentations. So there are some basic skills for negotiating. Know what goals you have for the interaction and what the outcomes are that you want to achieve. Know what compromises you are comfortable with in preparing for the negotiation. And make sure you find the right time and place to have the conversations with your preceptors. So here are some tips for negotiation. Set aside time and a quiet place for the conversation. Try not to do it in the hallway or when things are really chaotic. Look for small areas of agreement for you to build trust with your preceptor. Try not to take a rigid position or start to blame the person or make absolute demands for your position. It's important to remember to ask questions, both probing and clarifying, so you can carry on a discussion about what you're trying to negotiate. Remember, it's important to keep your cool and to document what you've agreed on with your preceptor. It would be good to write it down just so that you can go back and say, we did agree on this and I'd like to see how we can implement it now. Always plan follow-up. It would be a really good idea in a few weeks' time to try to sit down with your preceptor and just review what you've done to date and see if you're on track to get the things that you need for your learning. If you are at an impasse and can't resolve this, seek help. And help can be me, the SCP director, or your PCM group. The other thing that's important, envision yourself succeeding. This is an important part of your education, and you are critical to your success. It's good to rehearse some of your strategies and to use facts as part of the conversation. So, thinking about SCP. When you start out at SCP, we recognize that it can be stressful. Remember, it takes time to build relationships and to figure out how the office works. Your skill in negotiation will increase over time. Learning to negotiate at SCP can be a safe place for you to learn these skills. You need to have high expectations of yourself and realistic expectations of the experience. Take the lead on letting the preceptor know what your assignments are. Despite the fact that they all get copies of the curriculum, sometimes they are not as up to date as you should be about your learning objectives. Aim for regular conversations about patience and about your skill development. Set goals with your preceptor and review them each semester. Ask questions, but discuss the hows and wheres with your preceptor. Should you do this in the exam room? Should you do it in the hallway? Can you go to the conference room? And what time of the day would it work for you to sit down and meet with your preceptor to discuss some of your learning needs? Think about where you can shine each year, i.e., in year one, you could be this whiz at giving shots. You can be the person who does behavioral counseling or do really good smoking cessation counseling in year two. So what is the role of the school in negotiation? We want students to understand that we know that beginnings can be difficult. Certainly going into a new office at the beginning of your academic career at the University of Connecticut School of Medicine can be stressful, and we understand that. Expect that the preceptors will understand the goals, and we also expect that they will be able to give feedback to you every semester. It's important that the logs and contracts are utilized because they can be a great help to you in sitting down with your preceptor and going over your accomplishments and things to focus on for the coming weeks. We are committed to educating our preceptors about how to give feedback to you. We have developed some modules that they can utilize to review about giving feedback in office settings. Any student who has issues with their learning at SCP are encouraged to either talk about it with their PCM core group or come to the SCP office and meet with me. I am happy to sit down with students and review the ways that people can negotiate their issues and resolve some of the difficulties. I hope these modules have been helpful for you. They are a starting point for you to think about and learn about the art of negotiation. I've included some references that you can use if you want to explore this further. I would also like to take this opportunity to thank Dr. Michael Steinberg, who's an internist at the University of Connecticut Health Center, and Ms. Avery LaChance, a rising fourth-year student who helped us with these videos. I would also like to extend my thanks to a number of fourth-year students who helped us by participating in focus groups. Thank you.